Public health burden of vitamin B12 deficiency in India. Challenges and interventions. Vitamin B12 deficiency poses a significant public health challenge in India, particularly due to diverse dietary habits and socioeconomic disparities. This scientific note examines the prevalence, causes, and consequences of vitamin B12 deficiency in the Indian population. It also explores various interventions and strategies implemented by the Indian healthcare system to address this nutritional issue. India, with its vast population and diverse dietary patterns, faces a substantial burden of vitamin B12 deficiency. This deficiency is prevalent among various age groups, impacting both rural and urban populations. Prevalence and causes. Diverse diets. Traditional diets in India, especially vegetarian and vegan practices, often lack sufficient sources of vitamin B12, leading to widespread deficiency. Socioeconomic disparities, limited access to quality nutrition and healthcare services, particularly in rural areas, exacerbates the deficiency gastrointestinal disorders. The prevalence of conditions like atrophic gastritis and helminthic infestations hinders B12 absorption. Lack of awareness, limited awareness about the importance of balanced nutrition and deficiency consequences contributes to the problem. Consequences of vitamin B12 deficiency in India: anemia, particularly affecting women and children, leading to fatigue, weakness, and impaired cognitive development in children. Neurological disorders, peripheral neuropathy, paresthesia, and impaired cognitive function, affecting the quality of life. Neurological disorders, peripheral neuropathy, paresthesia, and impaired cognitive function, affecting the quality of life. Interventions and strategies. Nutritional education and awareness. Public campaigns, government initiatives to raise awareness about balanced diets, especially in schools and rural communities. Community workshops. Conducting workshops to educate communities about the importance of vitamin B12 and sources in both vegetarian and non-vegetarian diets. Interventions and strategies. Food fortification programs. Fortification of staple foods. Introduction of fortified foods like cereals, milk, and edible oils with vitamin B12 to enhance dietary intake. Government regulations, implementation of regulations, mandating food producers to fortify certain products to combat deficiencies, interventions and strategies, healthcare infrastructure, strengthening primary. Healthcare centers, strengthening rural healthcare centers to provide regular checkups and nutritional counseling. Antenatal care, incorporating B12 screening in antenatal care to address maternal deficiencies and promote healthy fetal development. Interventions and strategies, research and surveillance epidemiological studies, conducting nationwide studies to understand the prevalence and regional variations of B12 deficiency. Policy recommendations, formulating evidence-based policies to guide interventions and healthcare planning. General conclusions. Addressing the public health burden of vitamin B12 deficiency in India necessitates a comprehensive approach involving awareness campaigns, nutritional education, fortification programs, and strengthening healthcare infrastructure. By implementing these interventions, India can significantly reduce the prevalence of B12 deficiency, thereby improving the overall health and well-being of its population.